Hi, Anne. Anne and Nikki, I think you are new tonight.
Yes, nice to meet you.
To meet you. Thank you for being here. Um, I decided instead of trying to share all of my handouts via email, that I would just put them on a big Google Drive. And then as I do lit searches for things, I'll just throw articles that I think might be interesting for you on there, and then you can read them at your leisure. Um, I'll also throw some videos and things too, so you just so you have a little extra information about a lot of different things. um, I did speak with Kitty Verdolini Abbott, and she said she'd be willing to set up a Lessek Madsen resonant voice therapy training.
Oh, wow.
And she also said she would look into getting CEUs for those who are already active clinicians. So, how many of you would be interested in that? Okay, excellent. I took the training in 2000. That was one of my first big clinical trainings. I think I was working for Ingo at the time. So yeah, I think she did a training like kind of near a summer Volcology Institute program, so that was convenient. But it's really the bones of a lot of what we do in voice therapy, so I think it's really great. So I will get back to her, and she said March or April was what she was thinking. So we'll get some dates from her, and then see what we can do. But I'm glad you're all interested in that. Um, how many of you have been certified in LSVT training? Okay, great. And how many are interested in getting LSVT training? Maybe. Okay, I can look into that too. Um, so I guess we'll just get started. Tonight's going to be all about semi-occluded vocal tract exercises and theories. I hope I made the lecture section hopefully shorter than last time, so we'll actually have a chance to play and talk and explore a little bit together. All right, I'm going to do this. All righty. Can you all hear me okay? Awesome. So semi-occluded vocal tract exercises um, next to inhalation phonation are probably my go-to most of the time in treating patients. There are many options, obviously, in semi-occluded vocal tract tasks. Um, and even the golden retriever enjoys them. So, what is SOVT? I'm sure most of you have some idea, but since I had the pleasure of working with Ingo for 6 years, we got to explore a lot of this together, and we wrote the SOVT therapy program that was part of a Senate grant looking at vocal fatigue in teachers. So that was really cool to be picking his brain about all of this. So he basically says that SOVT is basically partially occluding the vocal tract. So you have a narrow aperture in front, which optimizes the posterior space in the pharynx, and it increases the air pressure between the vocal folds. So you've got some glottal resistance and slightly adducted vocal fold configuration together, which is why in therapy it's so great for almost everything. Um, basically they can optimize the closure of the vocal folds, open the pharynx, and that tends to happen pretty immediately during the exercises. So it's great for the patients because they hear their voices in a different way and usually more robustly, often with less breathiness if they do have a vocal fold closure issue. Um, and it's very motivating. And if you can motivate your patient on day one, they're more likely to stick with it and benefit more from the therapy in general. Um, so the method of the straw phonation in particular, I think, is tricky, and we'll definitely talk about my strategies, and maybe some of you can share some of yours. So it's not necessarily done perfectly, especially when we're doing the telehealth. So it's giving them really specific instructions is important so that they get the most benefit out of the exercise. Never forceful. Usually I like to have a little airflow in as the primary sound, and then add the voicing on top of it, and we'll go over that later. But it also, SOVT improves the vocal tract configuration. And this is, I'm gonna show you a video about this in a second, which is just really cool. So the different types of SOVT, it's not all straw phonation. You can, that is a common one, and Anna Marie Laukkanen and Ingo Tietze were kind of the two names for straw phonation. Laxvox was developed in Denmark by Marietta Sivo. Lip trills, I think, is sort of a universal knowledge. Resonant voice therapy, Kitty Verdolini. Abbott, I guess, is how she goes now. Vocal function exercises, Joe Stemple. And then there's a hand method that I haven't ever used personally, but it was Bernie Coffin, who is a pedagogue, came up with this. And then one that I add, I call puff, which is just using your mouth with back pressure, intraoral back pressure, and a little bit of escape of air and voicing through a small space at the lips. And this is great for when someone doesn't have a straw handy, or if they want to practice in the car and they don't want to have, they don't want to hold on to something. The puff is a great option. So I will definitely share that with you. Some people call it blowfish. I think my colleagues at Shenandoah use the term blowfish. So this is straw phonation, and the research is pretty mixed, and you'll see in the Google Drive I've put a bunch of articles, and I'm going to add some more. But really what I gleaned from the literature review is 3 millimeters, which is this singing straw. This is the brand that I use, but there are a lot out there. I like the singing straw because it comes in this little bamboo case with 3 millimeter straws and a little pipe cleaner for easy cleaning. Because I mean, back in the day when we only had access to plastic straws, I know that mine always ended up at the bottom of my backpack or purse, and I'm sure that wasn't very hygienic. So it comes in a little cloth bag and these great straws. So if any of you want to order them, the company gave me a code for a 10% off discount, and that's just Core Voice, all caps together. But the straw phonation can be done in just with the straw. And I often start with just airflow first. Again, so that the patient gets a sense of what it's like to blow in this narrow tube. I will often put my tongue on the bottom lip just to get the tongue out of the game. And I actually like adding puff in my cheeks. when I do this. I don't think it's necessary, but I find it's more stable doing the exercises. So, um, so you can use this as a training tool for speech and for singing. I use it in a hierarchical fashion for speech. So I would start with vowels in the straw, out of the straw, pitch glides into vowels, pitch glide in the straw, and then out of the straw on vowels. And then connected speech in the straw and out of the straw. And those are just, pretty easy and straightforward ways of using the straw. When I have patients who are post-operative, I usually start with the straw in water. And I still use this sized straw, even though the LaxVox, which you'll see later, is a big, wide, I think it's like 9 centimeters, and a pretty wide aperture. It's like a big milkshake kind of straw. So the way I use this is just a little cup with probably an inch or so, or maybe a little bit long, a little bit more, and then just, and you can do pitch glides. And lots of stretching exercises, which are good for post-operative, and I'm sure we'll have a whole session on that. But I really like the straw. And you'll see in a second there's another straw called the voice straw, which comes with a cup that you use to formulate speech a little bit more easily. I guess it's not trapped in the mouth. But it's so handy. I use this every day. And I can send you my little straw phonation YouTube videos that I made of just 4 basic exercises that patients can do. I have a speaking voice version and I have a singing voice version, and they're just really great daily exercises for voice building, voice maintenance, getting strength. And what I really enjoy about all of these exercises is that they really do a nice job of targeting all subsystems of phonation. So even just blowing in this little straw, I feel my pelvic floor engage, my abdominal wall move in toward my spine. The pressure system is primed, and then you, of course, get sub and supraglottic pressure around the vocal folds, which improves the glottic configuration. And then also the interaction in the resonator. You get a little bit deeper, larger posterior pharynx, so you get a better epilaryngeal tube to maximize the harmonic series in the voice acoustically. So there's so many things to say, but I think I just will play with these kind of things, and you can ask questions also afterwards. So I think that the 2 most common companies that make these straws in the 3 millimeter size, which again is what's most recommended for voice building. So the singingstraw.com and voicestraw.com. And the voice straw is the one with the cup, and I'll show you this in a second here. I had to contact the voice straw company so that I could get permission to show you this video. And they said also, oh, well, if anyone wants to buy one, just tell them to put in KDEMRIC as a code. So there you go. You have lots of discounts available to you. So this is a really cool video. I might stop along the way, but I might just play it through once and then we can talk about it.
What we're seeing here is the backside of the larynx. When you vocalize, air comes up from the lungs and the vocal cords start to vibrate. You'll see here that the vocal cords aren't in sync with each other. This asymmetry could be the result of muscles that aren't balanced or coordinated, so you'd hear a periodic break in the sound. What we do want is the vocal cords coming together evenly and symmetrically. When you vocalize into the straw, the air that can't escape through the straw provides pressure backwards to the vocal cords from the other direction. This is represented by the dots you see flowing backwards. That balance between the forward pressure and the backward pressure allows the vocal cords to balance symmetrically and square up. This is when you get the best sound and the most comfortable feeling. Another benefit of the straw is that it actually changes the shape of your pharynx. That's your throat. When you use the straw, it creates more space and length in your vocal tract. More space and length can allow the vocal tract to maximize or boost acoustic energy. Large differences in spaces provides more flexibility and choices for positioning and improves voice qualities with an easier sound. As you do your exercises, you'll eventually want to integrate vowel and consonant sounds with the voice cup. Now that your vocal cords are in the optimal position, they can work together with the rest of the vocal tract to balance your aerodynamic pressures with the acoustic energy, making it so that your vocal cords don't have to work as hard to create sound.
Wasn't that cool? I'm sorry, I just kind of geeked out about that. But would anyone like to see that again? Okay, so just pull it back.
Could you hear it okay?
What we're seeing here is the backside of the larynx. When you
So I also like their little lung animation. That's pretty cool. So obviously you've got your lungs, your trachea, and then they've done a cross section of the larynx, so you can see
the larynx. When you vocalize, air comes up from the lungs and the vocal cords start to vibrate. You'll see here that the vocal cords aren't in sync with each other.
So this is an important thing because a lot of times when we see patients and they have a little bit of a flutter in their voice or they have a paresis, this is sort of the vocal fold configuration that they're dealing with. And it's just really nice to see what is exactly happening. And obviously we're not seeing the cycle per cycle vibration because you can't really see that with the naked eye anyway, but it's a nice little averaging and description and depiction of the vocal fold vibration when they're not entrained well.
This asymmetry could be the result of muscles that aren't balanced or coordinated, so you'd hear a periodic break in the sound.
So it could be, it could be muscle tension or dystonia as well.
What we're seeing here is
Sorry, I think I got a little like.
You'll see here that the vocal cords aren't in sync with each other. This asymmetry could be the result of muscles that aren't balanced or coordinated, so you'd hear a periodic break in the sound.
So now this is, I think, it looks kind of robotic, but obviously you would have a complete seal with your lips around the straw, and here in their depiction there's a pretty big gap, so that is not correct as far as the use of the straw.
Do want is the vocal cords coming together evenly and symmetrically. When you vocalize into the straw, the air that can't escape through the straw provides pressure backwards to the vocal cords from the other direction. This is represented by the dots you see flowing backwards. That balance between the forward pressure and the backward pressure allows the vocal cords to balance symmetrically and square up.
So just like the sound returns to the vocal source acoustically, so does the pressure. And it's just really interesting to see that.
When you get the best sound and the most comfortable feeling. Another benefit of the straw is that it actually changes the shape of your pharynx. That's your throat. When you use the straw, it creates more space and length in your vocal tract. More space and length can allow the vocal tract to maximize or boost.
So, and again, this is really an important thing because that's where the maximum boost comes from the posterior pharynx. So, you know, right behind the vocal folds. And when that space increases in size like that, you get a much bigger acoustic spectrum of harmonic energy, which means more resonance, more projection, and for singing, the singer's format. Okay, I didn't mean to do that.
positioning and improves voice qualities with an easier sound. As you do your exercises, you'll eventually want to integrate vowel and consonant sounds with the voice cup. Now that your vocal cords are in the optimal position, they can work together with the rest of the vocal tract to balance your aerodynamic pressures with the acoustic energy, making it so that your vocal cords don't have to work as hard to create sound.
So interestingly here, they
Have two different sized straws lengthwise, but both of them are 3 millimeter in diameter for resistance. And the other thing that I forgot to say is that you can use more than one straw at a time. So if you have a patient who just has a hard time making sound in one, if you add two straws, really easy. And also the water, the lax Fox option also has dual resistance, so it's a little bit easier to phonate, which is why I like to use it post-operatively. So I'm just going to recap some of the highlights of how this all works, because it does go by really quickly in that video. So basically, these are good conditioning exercises because there's less collision on the vocal folds. And so that means decreased impact and pressure, which allows the vocal folds to entrain better, but then they're slightly abducted, sort of like in resonant voice therapy. So it's sort of like working out in the pool, which I love doing. It's a little less impact on and stress on the muscles. And the other thing that I like is that if you do start with airflow only, you can calibrate how much air should be realized out of the end of the straw when you add voicing. So it's really an important thing to train so that they can feel how much air that should be there when the voice is there. If the airflow decreases, there's some extra play in the muscles around the larynx that is actually impeding the airflow. So that's why it's an important training tool. And then when the mouth is open, air pressure comes up from the lungs, impacts the bottom of the vocal folds, and is expelled through the mouth. So you can see the pressure builds up underneath and exhales. And while some pressure always returns when the mouth is more closed, more pressure is reflected at the lips and returns to the vocal folds. So kind of like the acoustic aspect of phonation. And the back pressure helps align the vocal folds up in a more balanced, squared up position. And that's what I refer to as entrainment. So you have a nice squared off configuration to allow better vibration. And this was interesting today. I had a patient with an anterior glottal gap, and I gave her the straw, and well, I had her order it actually ahead of time, and she had a huge shift in her phonation instantly, and she was like, wow, I'm really encouraged. So that's one of the things that's really great about all of these SOVT exercises, that it's just really pretty immediate. For singing voice, it's using the straw to do slow pitch glides is really great for working to achieve what I call one voice. So there isn't a huge register shift along the way. It's just all the way through one connected voice. So really, really effective for that. I use that all the time in my singing studio. So here's the straw with the back pressure reflected from the lips to the vocal folds. So you've got supra and subglottic pressure influences. And that's what helps create that squared off configuration. And as the folds open, the positive pressure in the vocal tract pushes them apart even more, so they get a better overall amplitude of vibration. As the folds close, the negative pressure in the vocal tract pulls them together even more. So just a fun little physics lesson. When the positive and negative pressures of the vocal tract line up with the opening and closing of the vocal folds, it's like giving someone a push on the swing. So it's just kind of a fun little easy, efficient way of teaching your patients how to phonate. And I really can't emphasize enough just the interaction of all subsystems, really getting them to feel their breath and without really having to train it in isolation, because they will feel it pretty quickly. So creating the right space and pressure in the vocal tract equates less impact on the vocal folds, and more pressure in the vocal tract, less input needed from the vocal folds, so less fatigue. And one of the things that I think you have to really be aware of is if you have a patient with a lot of compensatory muscle tension, you might want to do inhalation phonation tasks first to really release that muscle tension behavior before you put them in the straw. Because if they carry the tension with the straw, they're going to get better at the tension, which is why when I do this, I make sure that they start with airflow. But even with the airflow, they can feel quite a battle between the muscle tension and the airflow. As long as the airflow doesn't decrease, the airflow is still winning. But it's always good to I sometimes will even have them inhale phonate and then blow on the straw, so that for those who have a pretty significant and well-established muscle tension pattern, that you give them a strategy to release the tension and then do the SOVT exercise. So this is LoxFox. I don't know, I thought I had a picture of this, but have any of you seen LoxFox, the device that's actually from Denmark? No, okay. It comes in a pretty tall cup and then a really pretty thick straw. So it's a 35 centimeter tube, 1 centimeter in diameter, with a 2 millimeter wall of the straw. So much, much bigger than our 3 millimeter singing straw, or so very, very different, probably really good for post-operative, because there's just a nice, easy, gentle movement of air and voicing. It's also probably great for people coming off a hemorrhage or a vocal fold mucosal tear. People who have other pathologies too, like post-operative anything probably. But there isn't much resistance in this because it's such a huge tube. The water does provide a little bit more resistance, but they say it's really more for vocal massage of the muscles and mucosa. So very, very specific use of LoxFox here. Definitely plays a role. I think you can make your own device pretty easily just by getting the right sized tube from even Home Depot. Probably sells something like that. So I don't think you have to buy the, because it's pretty pricey to buy the actual LoxFox from loxfox.com. But check it out so that you know what it looks like and how it works. I find that I can be pretty successful with my straws in water, but I haven't ever actually used their device to compare. So in fairness, I can't really say I've researched it. So the method for this is to place the tube in the mouth, between the teeth and above the tongue. Hold the bottle near the body, and this is true for straw, anything. So you want the straw to come to the mouth, not the mouth to come to the straw, so that you don't change the posture of the head and neck. Then enclose the tube with the lips, and if you, my colleague, well, a bunch of my colleagues will actually use a little bit of a pucker posture of the lips to seal the tube, and then the other end goes in the water, 1 to 2 centimeters deep, and you can work up to more water in the cup for more resistance. But 1 to 2 centimeters is actually pretty decent, and I find If you have too much more water in it, you get, this I think has a cover, but if you're just using a cup, you get a lot of spray. So they recommend inhaling from the nose, like yawning with the mouth closed, and then exhale from the core as you blow bubbles in the water, basically, and phonate. And they're just saying no pitch modulation, just inhale and 2 to 3 minutes of phonation in the water. The goals for LaxVox, I think we talked a little bit, but increasing vocal tract inertance, which we saw in that beautiful video, enlarging the resonance capacity, which we also saw, enlarging striking zone of the vocal folds vertically and longitudinally, optimizing tone of the muscles, intrinsic and extrinsic laryngeal muscles, and optimizing the shape of the vocal fold for functional mucosal waves. So that's really important, that squaring off of the vocal folds. And that results in formant tuning in the vocal tract. So the next one is lip trills. And I thought I'd share a funny little video with you. So not only can you use lip in your voice therapy, you can call. So then you can see how truly nerdy I am. But the lip trill is just such a classic exercise. You can use it with kids really well. And I have this, sorry, I have a little slide in a second on that. But I use this for singing. I use this for pitch glides with healing. If you do the lip trill, as you go up in pitch, you feel the need for a little bit more breath pressure. So you feel a little bit more abdominal support kick in naturally. This is great, really great experience that the patients can really quickly embody as well. I will sometimes, if I see that there's tension in the tongue and or jaw, I will modify this to a tongue lip trill. And you'll notice that I do this a lot. I call it the mom no, or a little head bobble, because a lot of these exercises, especially when you're dealing with a straw in front of you or a cup and a straw, the body can get tight and you can recruit the muscles in the side of the neck and in the back of the neck. And of course, we don't want that for voice production. So if you just otherwise occupy the muscles for movement of the head, they can't be as active in trying to be supportive for phonation. So that's my little tongue trick. Again, really immediate connection to the power system, reduces extrinsic laryngeal muscle tension. It's when you have a focus at the front of the mouth, it's really much harder for the throat muscles to engage, and even the false vocal folds, the posterior pharyngeal constrictors. So it's just really nice. You've got this really forward, again, common theme in the semi-occluded vocal tract exercises, but this really forward posturing of sound production. And then at the same time, you've got decreased phonatory effort. So again, patients are feeling that it's easier to make sound, and again, they're motivated with the improved sound and the improved glottic closure pattern. So for those of you who work in peds, you can kind of use the lip trill as their phonation. So like I try to use my healthy voice. It's sort of like I grew up with a show called Zoom. You probably are all too young to know about it, but there were a lot of different sounds that they made as sort of a fun little way of communicating. And this is just a fun exercise for kids. They love it. Most of them know motorboat or some kind of version. So, or they make spit, so it's fun. Probably not so great in COVID, although hopefully we're moving in the right direction with that. Um, but you can have fun. You can do little pitch games, have them go up and down in pitch, sustain phonation, sentences, all sorts of things. One of the fun things I find in doing voice therapy is just the amount of creativity you can apply to the exercises and just make it fun for you and for your clients. Resonant voice therapy, like I said, is sort of something I continue to draw on for speaking voice and singing voice therapy. As some of you watched the video on the inhalation phonation hum sets you up for a really nice, easy, tension-free hum and lots of secondary vibration at the lips, and that's always a good thing to cue with your patients. So a little bit of release between the back molars, so no clenching of the teeth when they're humming, but a tall inside mouth. And you want to really go for tickle. And sometimes it's so tickly, it itches. But that's what we want. We want nice and tickly. And when you go through the training of the Lessek Medicine resonant voice therapy, she starts with a physical relaxation. So she works on the body to really promote relaxation, connect with the breath, and then she gets into the target sounds of the hum, the M, the N, and the NG, all of the nasals in English language. And this is great because everyone can hum. So lots of vibration here, lots of relaxation in the jaw, head and neck, connection to the breath, all these things really important. But again, since this creates this slightly abducted vocal fold configuration, it's great for working with patients who have benign vocal fold lesions, for anything hypo or hyperfunctional. Actually, it's such a safe exercise to do, and it gets them kind of aware more of their resonator, which is great, so that they can think about where they want to feel secondary vibrations, and that's very tangible. So it's a really nice exercise program to work with all types of patients. And I think too, because of the secondary vibration, which you don't always get with the other forms of SOVT, you can really put your hands on your cheeks or your nose and your lips and feel the secondary vibrations of what's coming from the vocal folds and moving through the vocal tract. So kind of a neat way of educating the patient too on how phonation works as well. And the goals of this therapy program are to have a strong and clear voice. We use this a lot with teachers, just to give them a little bit of an advantage acoustically, to have their voice carry over background noise and also be pleasant up close. And this also helps reduce the collision forces at the vibratory edges of the vocal folds, so there's decreased injury and increased vocal efficiency. So lots of bonus. So like I said, we're going to try to hook any of the mentees up with the training program. Those of you who are interested, who need CEUs for ASHA licensure, we're going to try to connect that too. So really, really love this. And then vocal function exercises. So this was probably one of the first programs that was well researched and out there and pretty simple to use, but also very effective in strengthening the voice, improving overall phonation, and in all subsystems of phonation. So specifically the goals of this therapy program is to strengthen and balance the laryngeal musculature, increase vocal fold entrainment and adduction, and coordinate all three subsystems of voice production. Um, so the first task is maximum phonation time on the vowel E. And you really just train the patient to do this with a nice full breath, and then exhale on E at a normal pitch and loudness for as long as they can. And that is a good exercise to coordinate respiration and phonation. And then you can also kind of get some normative data, the MPT for the patient, and track it over time, which is nice. The second step is a series of ascending and descending pitch glides. So great stretching exercises. There's a recurring theme on all of these, but stretching exercises are so important for improving the vibratory characteristics of the vocal folds. So you'll use them forever and always. So I saw write-ups that were different. They didn't necessarily say whoop and boom, but I got those specifically from Joe Stemple. So whoop, boom, and just really targeting highest comfortable, lowest comfortable, and then do a series of those until you get pretty smooth glides in both directions. The goal here is just to increase vocal fold vibration patterns and vocal flexibility and improve range. So this is great for singers as well, obviously. And then the last task is a sustained phonation. Again, I didn't see this on every write-up of the word knoll, but again, this came from Joe Stemple. What he wanted was a very narrow aperture, almost like an occluded and the nasal helps get forward. The no is it's a nice easy vowel to sustain, and this is sustained as quietly as possible without getting breathy. So if the patient's like, no, that's not a target sound that we're going for. We want no. And he recommends doing this on a series of 5 pitches. And if you have a keyboard, C, D, E, F, G. So middle C and then up the white keys, the 5 keys to the right of middle C. So easy to train and just really straightforward task, easy to remember. You don't have to have it written down. I do have this sheet in the Google Drive, as well as some research on vocal function exercises. I think it's another one of those standards. It's been around forever, and we've got a lot of data that shows efficacy of this program. So get to know it, play with it yourself. You don't have to just do the 5 notes. If you have a singer who wants to work on improving their strength in maybe a particular part of their voice, this is a great one to do just stepwise, or even up half steps. Maybe C to C, middle C to C4, or C5, I mean. So really, just very straightforward, easy to do. You don't even need a piano if you have a piano app on your iPhone or your smartphone. So I like that you can do this without any tools. You just you have it in your brain, and you can pull it out, and you can compare it, time after time. So it's great for objective measures as well. And Joe says that these are really to be used for hypofunctional voice disorders, hyperfunctional voice disorders, age-related voice changes, and age-related voice changes that we see the most are vocal fold bowing, or lack of good glottic closure without bowing, but just a weakness in general, some vocal fold atrophy. And then he uses this for elite vocal performers and high intensity speakers. So people who do trade shows, teachers, ministers, all the high functioning professional voice users as well. And then I just threw on here a little bit of research, and I know this is probably hard to see, but there is quite a bit out there if you are interested in looking at efficacy data. It's always nice to know that what you're doing in therapy has been studied and demonstrated with some statistical significance, that it's a worthy exercise. All of these really have shown to be to evoke change in a statistically significant manner, which is why I'm sharing them with you. But I really, I love all of these, but I love the straw phonation and resonant voice therapy, vocal function exercises. Yeah, they're all great. And I think most of these, I will put these actual studies, I'll put in the Google Drive as well, so you can read the whole study. It's interesting when you're doing research to think about the clinical questions you want answered. And I hope that all of you are considering doing research, because it's the clinicians that are in the field with the patients and have the questions that, that you're seeing with your patients on a regular basis. And I think those kind of studies are the most interesting because they have the most direct application. So, any questions? Go ahead and unmute yourself.
Hi.
Oops,
Okay.
sorry.
Go ahead. I'll wait.
I was just wondering, do you have a particular sequence that you like in terms of doing maybe lip trills first, or then straw exercises and then resonant voice, or vocal function exercises? And or does it depend on the client?
Yeah, I think it definitely depends on the client. And kind of what I said earlier, if you have somebody who's got a lot of muscle tension, I always address the tension first, because if you don't, then the tension patterns are just going to carry over into everything that you train, and that will make it harder for them to experience decreased fatigue, decreased maybe even achiness, and they won't be able to exhale the air appropriately because there's a little bit of dampening happening because of that muscle tension. So, I mean, sometimes the exercises themselves will help with the muscle tension, but that direct massage release exercise that I did on our very first session, which I think I have in the Google Drive, if you weren't there, very straightforward exercises, the inhalation phonation in a very hierarchical manner. And I think I also put the YouTube video from the Voice Foundation fall newsletter that I made. It's mostly for singing, but you can see kind of what I do with singing and adapt it to speech. Yeah, it's really so client dependent, because some people can't lip trill easily.
Right.
You know, I think if you can grab a little cheek and get them to do it, and they can do it pretty quickly, then it's a good exercise. But if you only have 30 minutes and you're spending 10 minutes trying to get them to lip trill, then it's probably not the right choice for them.
Right.
Whereas a straw, most people can blow on the straw. And even if they're just starting with blowing air into the straw so that they get their power system primed a little bit, it's a great thing. I I have 4 exercises that I use all the time, just because it's a little bit of a variety of exercise. I don't know that I have a specific rationale other than that, but I like starting with super stretchy exercise. So kind of like the whoop boom version in a straw, or as the vocal function exercise. But if you get them coordinating the voicing and airflow to a full pitch glide, now that was pretty smooth, but oftentimes you'll hear little bumps along the way, so, or missing notes. I'm trying to do it, but something like that. You do that full pitch range glide through their vocal range 3 times, 3 to 5 times, whatever. It doesn't take very long, so it's worth doing. But if they set it up really well and they keep their head nice and loose, and the tongue is released, the air is present, they're monitoring the airflow as they go. Really pretty good exercise. And again, if you have them get something with multiple straws, if one is too challenging, this is super easy, huge difference. I have I'll put a little YouTube video of my hierarchy in your Google Drive as well, so you can watch. There's also a YouTube channel for the singing straw, and she's a vocal coach, but she has lots of ideas, and that's kind of fun to just check out. But I like my full pitch glides. I like octave slides, and then I like a sort of a 5-1-8-1, so you get a little bit of down and then up, which is good for somebody with unilateral paresis, because you're getting them to do lots of different stretches with the chord. So so 5-1-8-1, and you see how slowly I go.
Mm-hmm.
It's the slow slide is really more therapeutic than having them just kind of go really quickly, because you're really creating a low, slow stretch, and lots of interactions between the lips, the vocal folds, the power source, the resonator, all at once. Did I answer, Lauren? Did I get?
Yes, this is great. It almost seems like it works on so many things in terms of increasing not only, well, the resonant voice, increasing like the loudness level, but also increasing the pitch variation.
Yes. I mean, that's why, I thought this would be a great talk, because it is all encompassing. And if you find one that you like and your patients like, I don't think there's a huge difference in efficacy between them. And that's why I was showing you some of the data. There was actually a research study that looked at, I think, straw phonation, lax vox, and vocal function exercises. And the results were pretty similar across the different approaches of SOVT. So yeah, if you have one that you like, and free is also an issue, especially for some of the patients. They may not be able to pay $30-something for a set of straws. So the puff you can do with the tongue out, or I'm stuck in my
Okay.
5181. And then the last exercise that I like, and this can be for singers and non-singers, as long as they can kind of make hear the pitches, is just an arpeggio. So for maybe someone who isn't as much of a singer, just 1 3 5 8 5 3 1. If you're working with a singer, you can do an extended pitch range. So kind of 1 3 5 8 10 12 11 9 7 5 4 2 1, as far as the numbers of the notes of the scale. But it's just a nice exercise for singers in particular because it gets them up through a lot of their range in one fell swoop. So I use that for all of my singers. I think I just have them, those are the 4 daily straw phonation tasks I have them do just as a voice building maintenance. I work with the Colorado Symphony Chorus here in Denver, and they use their straw phonation to keep their voices strong through the pandemic. And also just because we're still singing in masks. So it just helps having that little extra phonation resonance, the harmonic energy when you have to go through cloth masks. That's, you need all the advantage you can get. And I find that the people who are doing the straw phonation are not having any fatigue issues by the end of a 2.5 hour rehearsal. So that's really encouraging.
Very nice. Thank you
Nikki,
very much.
here, thanks, Lauren. Nikki, you had a question.
Hi, I just had a quick question. I mean, this is my first time being here because I ended up having to miss the other few that we've had, so thank you. But just if you could tell me again the name of the person that may be having a workshop on, was it the vocal, which one was it?
The Lessek Madsen Resonant Voice Therapy Program. I think that the name has changed quite a bit since I took it. I think mine was Lessek based Resonant Voice Therapy, and now it's
Could you tell me how to spell that?
Oh, I'm sorry. So it's named after um, an acting professor, Arthur Lessac. So his last name is Lessac. He
Okay.
was known for a resonant voice approach in training actors called the call. And he did things that were, very, very similar to what you learn in the resonant voice therapy, but also he did things like yee, like an e buzz, yee, just to get that secondary vibration up more toward the front of the mouth, and lifting the soft palate, getting a little bit more space in the posterior pharynx, those kind of things. But so that's where the Lessek comes from. And then Madsen is Kitty's prior last name, and then resonant voice therapy. So I think she is now Verdolini Abbott, but it's Kitty, Kittie, Verdolini, Verdolini, and then hyphen Abbott, Abbott. But I will reach out to her and tell her that we have several. I probably will do a little post on the Facebook page to see how many people might be interested, and she'll have a nice little group of people. But you'll enjoy that. You'll enjoy her as well.
So I'm still in graduate school, so I don't know if that's something that we do that if we're in graduate school, or do we have to have our?
It's a training program, so I don't think there are any limitations.
Okay, thank you.
You just like anything else you learn in grad school, you can't work independently until you are in your CFY, I think. But just having those tools before you even get started is really great. And you won't get CEUs, but you'll get this great program that you can use and study and really get good at, so that it informs all of your other therapy.
Wonderful. Thank you.
You're welcome. Hi, Anne.
Hello. Thank you so much for having this. This is wonderful. I have two questions about the exercises. What's the benefit again of tongue out versus just closed lipped for the straw? I guess I should start with that one first, and then I have another one.
Okay. Well, it's a very Kate Emmerich thing. That is my modification. I've been working with straw phonation since the early 2000s with Ingo. And I found that you can still be tense in your tongue if you're just blowing on the straw and adding voice. So my alternative to that is just get the tongue out of the play, so it can't try to press down for support of the voice. So you just put it on the bottom lip. And then the straw phonation works in the same manner. You still have a nice tight seal around the straw. You do the exercises in the same way. For me, no one else cues this in all of the instructions that you'll see, but I really think it's essential to do airflow first. So, and I always have them hold the straw so they can feel the air hitting their hand, so they know how much they should feel when the voice joins the airflow. If they do, and the air goes away, it's usually because they're engaging here, or they're humming into the straw and they're not blowing air. So I think that's just my adaptation. But I think it seems to be a nice step to ensure that you're training the right musculature. You're getting stronger in your larynx and not in your extrinsic laryngeal muscles. So that's just my almost 30-year of doing therapy strategy. But I don't think it has to be done that way. That's just my approach. We all have our own idiosyncrasies. Mine is just making sure that everyone's as free and released as possible. And that's why I also add the head bobble. Just because if the head's free, it's not locking and loading these muscles here.
I love that. I absolutely love that because I've never seen it with the tongue out. And I was like, ooh, something new. This is cool. But I just wasn't sure like if there was one benefit of that versus closed lip. But it's good to know because yeah, I've had a couple clients where the tension was in their tongue. Like we've relaxed everything else. And it's like, where is it holding on? It's gotta be the tongue. So that's really cool. The other question I had was about the straw. So I know I've always just been scrappy and used whatever straws were available, like plastic straws, reusable straws. How much of a difference does it make to use the really fancy straw? Or if I had a client make a straw out of a pen because they didn't have any straws. So they tore out the insides and were like, okay, I'm going to use this. So, and it worked, but I'm just curious.
I actually did a lit search to see if there was any research out there to see if there is an actual difference if you use a little plastic stirring straw versus a metal straw. I couldn't find anything, so we could do a little study. But personally, and this is just completely anecdotal, I find that because the metal has its own harmonic properties, that it reinforces a fundamental tone in the vocal and introduces it into the vocal tract, which I think helps increase the harmonic series in the sound production. That's my sense of it, but I don't know that for sure. I also sail around the world, and I'm not a fan of plastic. So that's another personal choice. So I had to buy a box of straws that were like this for plastic, and the smallest amount was 1,000 count. And it took me probably 5 years to go through 1,000. They're great because they they're just easy, but then you have 1,000 straws out into the universe, and that's not my favorite thing. So that's why I always had wished that someone would come up with a metal version of the stirring straws that I worked with Ingo on back in early 2000s. And now there are lots of different choices, and so that's my preference. I don't know. There's a different. I mean, I worked with the little 3 millimeter plastic straw for years, and I think my patients benefited from it. But I just prefer the dishwasher safe, easy, hygienic, easy to keep clean version. If it's not cost prohibitive. One thing I was going to share with you too about the tongue. So if you don't have a patient with a limited lingual frenulum, you can have them also, instead of just on the tongue, put the tongue on the bottom lip. You can have them slide their tongue tip to the soft palate, and that really helps get the tongue out of play too. So, and then it just releases. If you move, obviously, eventually you'll move to normal vowel production out of the straw. Then you have a tongue release and another tongue release as you come out of the straw, and the tongue just relaxes forward. So it's kind of a fun variation of the tongue on the bottom lip, just to do that. And I also will do that sometimes on the inhalation phonation. How are you? How are you? And then just release it. So you get a little bit of a tongue release on the inhalation as well. Yeah, that's just another little fun thing to do.
Thank you. That is really cool. I love it. Thank you.
You're welcome. Hi, Susan.
Hi, I'm working with a 5-year-old who has a posterior glottal gap because of intubation. She has to be intubated frequently. And so they're trying to inject gel, and it's helping for some of the vocal fold, but not the back. And I feel like she's using her muscle tension dysphonia to actually get voice sometimes, and to cut it out, she just goes to breath then. Is there, I mean, we've been trying a largish straw with bubbles.
Good.
And she was doing okay, and then as the gel goes away, then she starts bearing down. So I guess a couple of things. So I think I'm going to try the lip, the tongue on the lip, because I think there definitely is tension there, and that may help, and maybe introduce some lip trills. But have you heard of muscle tension dysphonia like actually being used to produce an effective voice?
Sometimes, yes.
Mhm.
In fact, I have seen patients only phonate with their ventricular folds, believe it
Oh
or not.
my.
So, yeah, it sounds like was she on a vent or was she?
Yes, when she was born, yeah. And then weaned off, and then now I mean, she's got a complicated diagnosis. So she's got some intestinal stuff that they have to probably every 6 months have to intubate her and then it just like cuts through those. She's a little tiny thing. So
Does she have any webbing at all from the vocal fold trauma?
they have not said that. I work in a school. I can't see anything. So I
Okay.
can only get, whatever report.
From a functional point of view, for a 5-year-old, a posterior glottal chink isn't abnormal.
Mm.
And usually with the development of their larynx, that resolves by adolescence.
Okay.
So I wouldn't be super focused on eliminating the posterior glottal chink. I would be more more worried about her entrainment patterns, the symmetry of her vocal fold vibration, the flexibility in her voice. And I think the
Yes.
strengthening exercises, maybe play with the puff with her so that she can regulate her own pressure with her own mechanism.
Mm,
If she's
mhm,
little,
mhm.
the straw might be too much, but maybe the big straw isn't giving her enough pressure differential to improve the entrainment of the vocal folds.
Okay.
So, something like would be um, a fun strategy. You'll have to let me know.
Okay, will do. Thank you.
Sure.
I have a thought about that too. I wonder if she's been on the ventilator, does she have a weak diaphragm maybe, and then she can't regulate the pressure, like, because the diaphragm, I mean, we think of it as inspiratory, but it's actually used in exhalation as a brake. If she can't regulate that, then she's probably blowing it apart and compensating by squeezing. So I don't know. I've never looked at that with somebody so young, but when I hear prolonged ventilation, I'm like, weak diaphragm.
Very, very good point, Rachel. And it also could be weak pelvic floor too. Um, with the so really good, interesting ideas to consider.
Mhm.
Awesome.
Great. Thank you.
Yes, of course. Mercedes.
I have a question. So I'm a CF and I'm getting ready to discharge two of my voice patients, and they're both really nervous. But it's their time, you know. We've been working a lot on SOVT, and they're just they just really want to know, like, how much should they be practicing at home. And I made them a home exercise program, and I just tell them to do as much as they can before they are going to sing, or before one of them like makes podcasts. So I just tell them to make sure that they do that before they ever, are going to have a performance. But I would like to know more of like an ideal, like a goal for how much time they should spend doing their exercises at home.
And are these adults
Yes,
or
they're adults. They both have muscle tension dysphonia.
okay, but you have ameliorated their muscle tension.
Yeah, they just really want to make sure that they keep doing what they need to do at home. And
What exercises have you given them for discharge?
I gave them the straw phonation, resonant voice. We were doing that a lot. Diaphragmatic breathing. Then I taught them how to do the inhalation phonation, so I did that too. After we worked together, so I did that, and then also the massages. So, kind of just all of that. I put it together for them, and so I
That
just
sounds really like a really beautiful daily vocal exercise program. Did you give them an order in which?
yeah, I did a hierarchy, like first to work on what was it, the like tongue trills, lip trills, releasing their tension through like massage first of their like of everything, whole body. And then I went to afterwards SOVT, and then resonant voice. So I kind of like, and then from like I gave them like from vowels to basically everything we had been doing in person. I wrote it out for them because they're older, so they really are like, I need some kind of written guide, because it's a lot. So I just want to make sure I set them up for success when they don't meet with me anymore.
Yeah, no, I think it sounds like you did a nice job. I like that you started with an easy SOVT exercise coupled with direct massage release, so they can really feel while they're phonating
Yeah.
their muscles, and that also gets their breathing and their power system dialed in.
because
Um,
before meeting with you and going learning from you, I was focusing a lot on breathing. I was a lot on breathing and just mainly like diaphragmatic breathing and making sure that they had that and then going from there. So, and they're really thankful now for everything else that I've introduced to them, and I am too. So I just want to know more about like how much to recommend every day, because my coworkers aren't voice like they know too much about voice, so I just want to make sure. I,
it's a little bit of a tricky decision because I would love to have my patients do 15 to 20 minutes 2 to 3 times a day, but none of them will.
yeah.
um, I mean, some will do more than that, right?
Yeah.
What I would say is maybe have them start with an amount that's manageable for them. So maybe 15 to 20 minutes.
Yeah.
And then if they have time, they can do another 15 or 20 minutes later in the day. And then as their vocal demands increase, they could increase their practice time just to build more endurance and more control. And just it depends on their goals too. If they wanted to get through an hour podcast without vocal breaks, then you want to have them ultimately work up to the almost the amount of time that they're going to have to use their voice.
Okay.
um, so that they know that if they practice 15 minutes 3 times a day, they have, and they can say they have no problem doing their hour podcast without vocal issues, then that's a successful amount. Um, Anyone else have any strategies that they use in therapy as far as how long to practice the exercises? Rachel, you look like you might want to say something.
Well, I mean, I'm a voice teacher, so yeah, I mean, we all want to be able to do a full regimen of every exercise and get all of the notes and feel really good. And that doesn't happen. So, if something is better than nothing,
Mm-hmm.
and I feel like, if you're the farther you get away from the hand holding of having your teacher or having your therapist with you, the less it becomes. So it becomes like, okay, what is the bare minimum? And even for me, like right now, I'm in school, so I have no time. And if I can grab 5 minutes in my car after I drop off my kids, that's great. But I find that if I'm consistent in my practicing, I don't need that much time to warm up. I need, maybe 3 5 minutes of actual exercise time, and then I'm in a good place where I can continue to warm up as I'm speaking. But if I haven't been practicing, like now I'm speaking as singer Rachel, if I haven't been practicing, it'll take me 2 to 3 weeks to feel good, and I need to be like really consistent. And in those warm-ups, I need to be really practicing for like 20 to 30 minutes and actually like really focusing on it.
Yeah, I think that's a really good point, and it's variable based on your goals. And so I think it's very patient or client centric. But sometimes you can give them, if you have the time and energy, you can make them a little YouTube video so that you can take them through exercises and you can say, okay, well, this is what I would do as a bare minimum, kind of like what Rachel was saying. And then if you have time, add these. And then, maybe put a straw in your car and phonate whenever you're at a red light or something, that's kind of a fun strategy. You can be so creative with this, but I don't know. It would be also another really good and interesting study to see like how much practice time is really enough.
So Kate, also I've seen Joseph Stemple have a maintenance program schedule. So it's like a 7 week schedule. So if you're focusing on the vocal function exercises, and oftentimes I'll sort of use that as a guideline for my patients for maintenance. So like week 1, he says, do all exercises twice a day, 2 times each. Then week 2, you cut it to all exercises once a day. Then week 3, like he slowly goes down to where you're only doing exercise number 4. And then I usually tell my patients, if you have 3 consecutive days where you're really feeling more hoarse, or you're feeling discomfort, or, something changes over the course of, the next 2 to 3 days, then go back to the beginning of where we started from, doing everything for, let's say, 10 minutes twice a day. I usually say 10 minutes. 10 minutes doesn't seem that long for people for some reason. So I'll say, try to do something in the morning, like mid-morning, and then later in the evening before you go to bed, 10 minutes at a time. This is usually, I'll pick like a couple muscle relaxation. Then I'll do like whatever their favorite semi-occluded vocal tract exercise is. I'll say like, what feels good to you? And then maybe even like a conversational technique. I see a lot of teachers or professional speakers, not so much singers. So we work more on conversational techniques. So like whether it's a little bit of resonance versus just like, I think it was Kitty Bernalini who did the conversational technique also. But there's like a structure in that also, as well as to how to have a more efficient conversation for a lengthier period of time where they're not fatiguing. So I'll say like, call someone on the phone and practice, or talk to a family member, or read something out loud, and that will be their conversation. So that's kind of how I do mine. For more, like I said, I see more voice, professional voice speakers, or just like the average voice user versus the singers. So
That's nice. Really great ideas, Lauren. I love the 10-minute number. I think you're right. It's not overwhelming. Um, I forgot about the maintenance program with the vocal function exercises. So thank you for bringing that up. One thing that I noticed, well, especially for professional voice users in general, is that you don't necessarily want them to stop their maintenance program. You want to keep them using their voice well, all the time, and that's just when you do sort of a 6 to 12 week program with them, they're getting into the habit of using their voice in that manner all the time. And so their 10 minutes in the morning before they do anything is such a great idea, so that they start their day using their voice well. And then I love checking in at later in the day, then see how they're doing, and just kind of refocus their attention to their voices. It's a really, really great strategy. Very nice. Thank you for sharing that. All right. Anyone else? Claire, Liliana, Claire? Heather, sorry.
Oh, yeah. Just wanted to say another idea that I sometimes do with some of my patients who sometimes claim that they don't even have those 10 or 15 minutes because they're busy on meetings in the car on the way to work, or with their kids in the car. So with those particular patients, what I do is I ask them to put like a Post-it, let's say, on their desktop, and every hour just check in with their voice with something like straw phonation, just to remind them how easy voice should really feel. So when they're talking on the phone, if they're starting to feel that level of tension, just to remind themselves, just for like 1 or 2 minutes. And then of course, if they can do more, do more. But sometimes I also find it helpful to say, if you could find smaller increments more often throughout the day, that is for some people sometimes more manageable than saying, oh, I have to find a block of time when I'm like, I'm in a meeting when I'm driving to work or something like that. So I try and come up with other ideas for those folks as well. So I just wanted to say that. I don't know if you've ever recommended that sort of intensity in like smaller increments.
Yeah, I love doing that. I love the post-it note on the computer screen of breathe or relax your shoulders, or whatever, any strategy that you're targeting as a goal for the patients can be a really nice visible reminder. And small doses are good, especially if they can be mindful ones. So I love that. Thank you for sharing that.
Yeah, and then I just wanted to add, Susan, about your patient. I didn't catch the whole history from the kid that you mentioned, but I was thinking, what if LSVT would be good? Because that's also a program for children. So if they're having closure issues besides the posterior, that's a program that helps also. I haven't been trained in it with children, but with adults I have. But I know they have a whole program specific to kids.
Yes, I used LSVT with another child very successfully, but this child, she's kind of bearing down with muscle tension dysphonia, and we can't get a good free voice yet. So
Have you tried the inhalation phonation with her?
no, not yet.
I'd be curious.
We've been off. We've been on break for a couple. I haven't been there, so.
I'd be curious to see if she can free up her muscle tension and then get subsequently better vocal fold vibration and entrainment with the inhalation phonation. And you can target, small inhalation hum and then work hierarchically into vowels and pitch glides and words and phrases with her. I think that the muscle tension focus along with functional voice would be a nice balance.
Mm-hmm. I think playing around with her voice also. I've been okay, let's try this straw phonation, and I think just playing around a little bit will help ease a little.
Definitely. Yeah, great. I love this. You guys, this is just exactly what I had hoped this mentorship would be. We were all sharing and helping one another, and this is you guys are making me so happy. Thank you for being here tonight. And if you have any questions that I don't cover, if you think of any, feel free to email me. You have my email. I'm happy to be here also to answer questions clinically. If you have, between our sessions, if you have questions and you aren't sure where to go with somebody, I'm happy to give it a go. I may not have all the answers. I certainly don't, but I'm at least have a little bit of experience under my belt to help a little bit. Well, if there aren't any other questions, have a wonderful rest of your evening, and I will probably send out something early this next week about scheduling the 2 sessions for March. And I'm going to send you a video. I just have to make it. I'll be doing a Zoom by myself on pre and postnatal voice. And so it kind of encompasses the hormonal changes during the cycle, and what the body's supposed to look like and how things are supposed to function without a baby. And then what happens when you have a baby on board through the trimesters and postpartum and pregnancy. It's not something that we learn about much in school, so I thought it would be a fun topic to just give you, and I have a handout for that as well, so it'll be a little something different. So thank you all. I am grateful for each and every one of you. For those of you who couldn't be here in person, thank you for being part of this as well, and I'll see you soon.
Thank you.
Thank you so much.
Thank you.
Thank you. Aloha.